We welcome you now to lab number 1. This is the lab following the first clinic. In this lab, the technician will receive the impressions, primary impressions. These can be either alginate or compound material. And he will have his instruments ready. He will have on the side a rubber bowl and a spatula. And he will have his material, plaster and water, because we're going to pour our primary cast using plaster. The technician had finished washing this impression for about a minute. This will reduce the microbial load on the impressions. And he's now going to use the indelible pencil to draw the outline of the sulcus from the outside. We have used black here for you to see the drawing clearly. And one feature of indelible pencil that it can copy itself into the cast once it's poured. So we make sure that we are recording the whole sulcus into the pouring of the cast. Now we are ready to mix our material. So we have 45 ml water and we have 100 grams of plaster measured out already. You will have them measured for your work. We incorporate the powder into the liquid. This will reduce bubbles, and we are going to wet all of the powder with the liquid and then begin squeezing them to the sides of the rubber bowl until it's a smooth homogeneous mix. This is the consistency of the final mix, and we're ready to pour it on the vibrating table. We use the vibration from the vibrating table to vibrate the impression while the material is flowing into the impression. This will increase the flow of material. Notice that if you see the material, it will flow better under vibration. Okay? Why do we need to slowly add the plaster in? You notice that plaster is a liquid material, and if we put it in lumps, it will trap some gas beneath it, gas bubbles. But if we pour it slowly from the side and let it flow into its place, we find that there are no bubbles there. It will reduce the bubbles into the surface of the impression, and we will have a smooth cast. In this first pour, we make sure that we cover all of the sulcus and we have the lines clear in location. So we cover all of the sulcus from all sides, and we use the remnants of the mix to add lumps to the surface of the first pour. The function of these lumps are, once they solidify, they will be as stands or legs on which the impression will stand while we're making the base. This will maintain sufficient thickness of the base and not having the sulcus touch the table, and then we will have enough thickness of plaster beneath the base. Now we are ready to pour the lower impression. For this purpose, we are using the same measurements of powder and liquid. So 45 grams water, 100 grams powder. We mix them thoroughly. The first mixture is to incorporate the powder into the liquid, and then we begin squeezing the material to the sides of the rubber bowl to eliminate bubbles. This will eliminate bubbles until it's a homogeneous mix and it's ready to be added to the impression. Once more, we are using the vibrating table, and we pour from one side to another, from back to front. This will allow the flow of the plaster. That we cover all of the sulci, all of the peripheries of the impression are all covered with plaster. Then we set it aside and add the lumps that will work as stands on which the base will be added later on. And now we are ready to let this impression set aside for it to have initial setting. We don't need the final setting, which is 24 hours later. We only need it to set for half an hour, enough to be solid to add the base for it. And now I would ask kindly all groups to go inside and take their impressions and have them poured for the first pour inside the working lab and set them aside to set before continuing the next step. The next step will be forming the base for all casts. Now we are ready to do our base. This is the second pour. We're going to add 35 ml water and the 100 grams of powder to the mixture. This mixture, we have reduced the liquid in it to make the mix a bit more thick and make it in a form that we could shape it in the base. So we incorporate the powder and the liquid in a quick mix, reducing bubbles. Then we take a big lump of this material and put it in the area we're going to add the base. And we'll be also adding some gypsum around the sulcus to make sure that we don't have bubbles in those areas. And then we invert the impression over the base material we have added. We press it until we get the base all covered with plaster. And please notice so we are smoothing gypsum all around the base area, and wherever we have a deficiency, we're covering it. We need enough material and sufficient material of base around it. And we make sure that once more the sulci are covered and included inside the base area. We leave it. After we shape it, we can wet our fingers using water and then just run through the sides and around the borders to make it smooth. This cast, we will leave it to set for around an hour before we begin trimming away the excess of the cast. Now we're going to begin with the lower base. We're going to follow the same steps. Liquid first, then powder, the thorough mixing, and once it's homogeneous enough, We're going to add it in lumps. Now we invert the lower impression over the base area until the stops begin. Now this is the only difference where we need to concentrate on when we're doing the lower impression. That we have the lingual area, or the area where the tongue was there, is empty now. So we need to add in plaster material that is sufficient into that lingual area. So we make sure that the material is covering all sulci. The same procedure as for the upper on the sides, but we're going to concentrate now on the lingual side, where we make sure that the impression material is totally covered with plaster from the lingual side, and we smoothen the tongue area. And we make sure we smoothen the total cast using water, and we run our finger in the lingual area, making sure that all gaps in the sulcus, all gaps are covered, and the sulcus is totally covered with plaster material and incorporated into the cast. Once more, we leave it to set for an hour before trimming. Now you are ready to pour your cast with the base, and make sure that your base follows the features we have talked about, and let it set for 1 hour before trimming. And now you're going to do the worksheet. Now, after the base has set, we are ready to take out the impressions from the cast. First of all, we need to check the borders of the impression. Any plaster that had run to the borders, we just take it away using a wax knife. So using a wax knife or a plaster knife, we begin removing any plaster that's overlapping the tray. This gypsum on the tray, while removing of the tray, might prevent the easy removal and might cause the fracture of the plaster in the land area. So make sure that the tray is free, only the tray. We also do this for the upper, so any part of the plaster overlapping the tray, and even sometimes of alginate. So even if alginate is on the tray, we also clear the tray from all the sides. Okay. Now that the trays are free from any overlap of material on them, we need to separate them from the cast. That usually for alginate impression, the casts might have been standing for all night long. This means that the alginate have dried out by the act of syneresis. So they might be solid, they are not flexible enough to take out. So we need to soak them. We need to soak them for an amount of time, 5 minutes, until the alginate sucks up some water and takes it up and becomes soft a bit more, so we can separate them. Once the compound is set over and the cast is ready, the compound now is hard, so will not be easily separated as well. Once more, we free the margins of the tray from all plaster. This tray is clear now from all plaster overlapping on the tray. And then we soak the tray part inside warm water. Okay, we soak the part in the warm water and wait for it to warm up, and then try to take it out and separate it. This makes the compound material soft enough. So if you're applying a lot of force, you stop and re-soak it. But if it becomes soft enough, it will separate from the cast easily. Once they are totally soaked and the alginate is soft enough, we can separate the cast from the tray and the impression. Notice in this case it went out all in one piece, and this is sufficient for cases where we have an edentulous patient. But for cases of the upper, sometimes we have undercuts. And also in cases where patients have teeth, we have taken impressions of teeth, this snap removal might fracture part of the fragile cast material around the sulcus or the teeth. So we can attempt the following, which is separation of the tray on its own, and then just fracture off the alginate material away from the fragile areas and the teeth. Okay, and then now we can fracture off. In this case, it went off as one piece, but if teeth were there, we can just section the alginate and take it out in sections from around the teeth. So these are the casts after we have separated the tray and impression material away. After we have separated the trays from the casts and we have cleaned off all impression material, we are ready to trim the cast. But note that the cast is all of one color. It's all white. So if you have done the step and taken care to do the step using indelible pencil on the impression and drawing the outer sulcus line, you will find it imprinted already in the cast, as you'll see in this case. You can see the blue line. It's imprinted from the impression surface which we drew. If in the case we don't have any imprinted line, we can just draw it, and this is more clear on the lower. We can accentuate the line, because while trimming and with the presence of water and powder running down the machine, we will not be able to see clearly through the cast. But once we have a line drawn clearly, we know where is the sulcus border that we want to keep. We want to keep the full depth of the sulcus. We want to keep the width of the sulcus. So we're not drawing inside the sulcus. We are drawing on the edges of it, the outer edge of the sulcus. For the lower, we could also do the same thing. We are drawing on the outer border of the sulcus, maintaining the full depth all around. Now this is an area of a bubble that was in the impression. We could also do it from the lingual now, also maintaining the sulcus width. We're not trimming here, but just to show you the outline of the sulcus from the lingual side. With the sulcus all clear and well defined on the cast, we are ready to trim. The trimming, we are using a trimming device which has a stone wheel, and this is solid. And with the friction of the cast, they become two solids frictioning over each other, but because the stone is harder, it will trim off the softer plaster away. Now the plaster, if it's totally dry, it will need a lot of effort to trim. At this stage, we are able to soak the base only of the cast for like 5 minutes, and this will make the base of the cast softer. We don't allow any water to run on the surface of the ridge area or the anatomical area. So to make the trimming easier, we can take the cast and soak only the base of it. The anatomical part is kept dry, and the water is only on the lower part. Rubber bowl where only the base is soaked. The reason why we don't soak the anatomical part is that gypsum dissolves by time, and we might lose some of its features and accuracy. So we need to make sure that only the base is soaked for the trimming step. Now you have 2 minutes to go and soak your casts to make them ready for trimming. The trimming device comes as a stone wheel and then a flat table, and as well we have the control for the power and control for water. When we put it on, we need to make sure that water is running from the side. The function of the water is to reduce the friction between the plaster material and the stone. This will first increase the efficiency of the trimming. It makes it faster and easier. It will also reduce the heat produced, and it will also lengthen the duration of your sand wheel, and it will stand for a longer life. So make sure that water is running while you're trimming. So for the trimming sequence, we put on the power and the water together. Then we trim, first of all, from the behind. You notice that we can see the hamular areas. So we want to make sure that both areas are equally distant from the edge, and this edge is flat. This makes the cast standable. So we can stand on the flat table and then begin pressing. We press until it's totally flat. And then we check on the table. And we place something horizontal over the ridge to make sure that the ridge is totally parallel to the floor. So if I place something flat over the ridge and look at it, it's parallel to the floor, that's enough for the base. Now we just begin rotating the cast around. While we trim, we are observing the line that we have drawn. So we press and make sure that we don't go beyond the line we have drawn from the top. We have preserved a land area. Once it's totally smooth, we can look closely at it, and we could see that the sulcus line is all around it's smooth, and the sulcus line is preserved, and there is around a margin around that sulcus around 2 millimeters. This is called the land area. This protects the sulcus during further procedures. We can bring now our wax knife and scratch that land area to become flat. Now to see the land area clearly, it might have sharp edges, thus we smoothen it lightly with the wax knife, and now you can see that it's totally flat and smooth around the sulcus, and we have the full depth of the sulcus all around our cast. And now this is ready for us to work on the next step of lab number 1, which is constructing a tray. We wash it, and that's our cast ready. And now we're going to show you the lower cast. And then we now can stand on the flat surface, press the base, we make sure that the ridge is parallel to the floor using a spatula, and once we make sure that it is parallel, we begin trimming the margins. We preserve the line. And we bring our wax knife to remove sharp edges from the land area all around. We'll also smoothen the lingual area as well. We have not trimmed anything from the lingual area. We kept the lingual area base present. Once it's totally clean, we need to check that the height of the base from the sulcus area to the base is at least 1.2 to 1.5 centimeters. So we have enough thickness of base to withstand pressure. Also on this cast, write your group number, your seat numbers, and your section number so we could identify your material.